So we're here today to talk about the Equally Well guide that we put out recently, which is looking at the physical health of people with severe mental illness, especially during COVID, and making sure that people have got the right information and supportive information. There's a number of different links and resources out there, and we wanted to bring them together in one place. And I was delighted to have Kevin very closely involved in that. We had a number of conversations, and I will let Kevin introduce himself.
Thank you, Emma. So yeah, as you say, we've worked very closely with our team of experts by experience on this resource. Really good resource, and it's been really widely accepted by a lot of people that I work alongside. So yeah, I'm one of the lived experience advisors to Equally Well and Rethink, and spend my time as a consultant working across health and social care.
So we're really delighted to have NHS England and NHS Improvement support Equally Well to create this guide. And I started off by having a number of conversations with experts by experience and experts by profession. And we started off by picking up key themes from people, finding out what we really needed to hone in on and do more work around, and then what existing work there was that we could feed into this. One of the main things that we started working on, which was a key theme from nearly everyone I spoke to, was around smoking and quit attempts. This is for a number of reasons, but also Covid-19 is a respiratory virus which affects the lungs and airways. As a result, smoking may increase the risk of a more severe coronavirus infection. If you want to quit smoking, please speak to your GP. There are also some great resources out there, like Action on Smoking, Quit for COVID, NHS Smoke Free, and also local quit smoking services. Kevin, we had quite a few conversations, didn't we? And you fed in some of the tips of what helped you quit smoking and what sort of initiatives you put in place to help you with that.
Yeah, so I think the tips and how I went about it was understanding what was out there in respect of support. So speaking to smoking cessation practitioners, my GP, looking at patches and other different forms of support. And I certainly didn't manage quitting first time round. It was, and I think everybody's ability to quit smoking is unique down to that individual. So, there isn't a one size fits all technique for giving up smoking. It's really down to each individual. For me, I found that not surrounding myself with other smokers was a positive, or certainly if I was going to get support from friends and family, I would tend to go to people who didn't smoke as opposed to people who did. I really struggled with some weight gain around giving up smoking because my body was detoxifying. I was craving all sorts of sugary, starchy foods. So I got some good support from my GP surgery, from a dietitian. And also I learned to do other things. So I picked up a couple of different hobbies. I've always been keen on gaming, so I picked up gaming again because, I was rolling my own tobacco, rolling my own. So, it's not just about the smoking, it's about all the preparation, it's about all of the things that you do. So finding ways of distracting yourself, your thoughts from, I need a cigarette, because those thoughts and cravings don't last very long, but you just got to be mindful that when they do kick in, you've got something there to support you with it. So for me, I made sure I surrounded myself with healthy snacks, fruit, vegetables, like lots of carrot sticks. I had quite a lot of hummus with my carrot sticks, but hummus, healthy fats, so that was okay. And I was just mindful that I set a realistic goal. So I didn't quit straight away. I reduced the amount of tobacco that I was smoking until I got to the point where I then felt comfortable to quit smoking completely. But like I say, it's not one size fits all for everybody. You've got to find a way that works for you, and just learn about what else is out there in respect of, you know, interventions. And, you know, a lot of people now use vapes, don't they, as an alternative to that. So, you know, so there are alternatives.
Yeah, no, 100%. One of the things as well that I learned about quite soon on of starting Equally Well was the fact that your medication levels can change with smoking. And I think it's something that people aren't always aware of. So if you are thinking of quitting smoking, then speak to your GP, because it might be that your medication levels will need to be changed. So as you did, Kevin, I think it's always advised to chat to your GP for advice.
I mean, certainly for me, some of the positives around why I wanted to quit smoking was definitely based around, so, you know, having type 2 bipolar, use mood stabilizing medication. For me, quetiapine is that medication, causes a lot of weight gain. Being able to quit smoking then led to a conversation with my health and social care team about, could I reduce those medications that would then have another positive effect about not having so much weight gain associated with the medication, but also the cravings associated with that medication, and also you know, just getting your smell and back and sense of taste, because you know, those senses come back to you after you've been smoking. So being able to taste your food properly and being able to, you know, was a real positive for me.
I bet that sounds quite a struggle, suddenly not being able to taste food. As someone that loves their food, I would have struggled with that. So we also looked at healthy weight management as a whole. We did break it up into sections for the resource just to make it clearer. But in terms of your healthy weight management, I think at the moment it's probably a lot harder with some aspects. And for instance, one of our other Expert by Experience members mentioned that she can get a takeaway in less than an hour, but getting any form of healthy food at the moment where she lives is a massive struggle. We've also been told by NHS England that the volunteer scheme, which has been set up for COVID, does support people with severe mental illness, but you are able to get help. The number is 0808 196 3646, and there's also an online referral form as well.
Just picking up on that, because you're absolutely right. Lots of people I'm speaking to are really struggling to get prioritised slots with supermarkets and so on. And a lot of people I know are relying on food banks, or there's schemes with local authorities that if you are seen as a vulnerable person, that you can get food deliveries, food boxes like once a week. That's really good. Those are really good initiatives. But the flip side to that is you can't guarantee what's going to be in the box that gets delivered to your home. So, you know, if what's being delivered to your home contains, you know, biscuits, chocolate digestives, sweets, and all of those other things, just be mindful with those providers, with those very kind initiatives. Maybe you can have a conversation with them and give them a bit of a steer as to what would be useful in your food delivery. I mean, obviously going online and doing a supermarket shop, you're in complete control of that scenario. But other really well-meaning initiatives, and they are really well-meaning, just be mindful that you know. So for me, I'm not going to use the word lucky. If I was lucky, I wouldn't need a personal assistant. But through a social care package, I have a personal assistant who is able, on my behalf, to go out and food shop for me, and she's in total control of what goes in the supermarket trolley, and I have absolutely no influence in trying to get sweet things added to that. And then obviously that person's able to cook at their home and not mine, some really good nutritious meals that she's able to freeze and then drop off in a separate delivery. So you know, have conversations with county councils and social services about whether you're able to get that kind of support in place.
Yeah, I think that's absolutely crucial at the especially at the moment, given the struggles. We also talked about having sort of tricky experiences was going to the shops, and I've spoken to one or two people that have got different mental health problems that have shared that just leaving the house to go to the shop at the moment is even more of a struggle due to feeling panicked and reliving past traumas or past experiences that they've started to be able to manage. What's your experience been? I know you mentioned that you tried to go to the shop once, but...
Yeah, I've been out a couple of times and really struggled with health anxiety and also COVID anxiety. And what I mean by that is I've been out to a couple of supermarkets where people just aren't observing the physical or social distancing rules for whatever reason. And by not doing so, it creates anxiety for other people who are trying to stay safe and distanced. Historically, I've struggled with social phobia and agoraphobia, and over the years, I've learned to develop mechanisms and ways of coping and strategies around that I've learned from other healthcare professionals. And I'm finding at the moment that actually, because we're being told to stay at home, work from home if you can, that actually, for me personally, I know for other people I've spoken to, they're starting to relive some of that trauma and struggle with some of those really intrusive, unwanted thoughts and feelings around, if I go outside, is this going to happen to me? Or you just develop fear of not going out because you haven't been out for a long time. And it's really tricky. So, being able to support people in their homes in the right way is really important, and being able to enable, empower and support people to get out, and support them with that while social distancing is really important. But it's really tricky and it's really complicated, and it's much more complex than just saying to someone, step outside and go and do your own shop. So it's really tricky.
No, 100%. Another thing in going through the resource is we talked about, and I think it was during the conversation I came up with the visual of snakes and ladders. So you were talking about prior to COVID, you were taking a sort of a journey with your weight management, and then you almost feel like you've gone down on a snake and taken steps back.
Yeah.
What are you doing at the moment to help with that, or what are things that you can share that you've learned through this?
So I think, in respect of that, sort of probably 2 months into, I think I'm in week 7 or 8 now of being at home, working from home. Around last August, off the back of some not very good results from my physical health check, joined the gym at UEA under a physical health weight loss exercise referral scheme. And I've been getting some really good support from the gym instructors there, and there's an in-house nutritionist who's one of the instructors. So they really personalise and tailor make an exercise regime for you based on your needs and complexities around your mental health and your physical health. And it was going really well. And this time last year I was 22 stone. I'm down to about 18 now. Worked really, really well. But now, during COVID, all of those initiatives have now closed down, and the only kind of options that are open to people was you can go out and exercise once a day. But if you are struggling with the social anxiety and agoraphobia, then that's not an option for you. So yeah, I and others who've been really working hard on eating healthily and getting the right amount of exercise to help with the weight loss. And help with mood and being able to sleep is really tricky. Yeah, so a lot of us, I don't use the word, I don't feel like I'm failing, but I just feel that all of the hard work that I've put in is as you say, it's like a game of snakes and ladders. So yeah, it's really tricky. It's much more complicated than saying someone just run up and down the stairs several times a day. That's your exercise, because a lot of people with severe and enduring mental health problems have complex comorbid physical health conditions as well that make it more difficult just to follow what might be an online exercise regime it's being delivered by a physical health trainer or whatever. So yeah, there's lots of us who've been putting the work in, or working towards certain goals, and we're now trying to be innovative and creative, and not blaming ourselves for not achieving the goals that we've set. So it's tricky, but yeah, absolutely. It's and also I've been getting support from one of the physical health trainers who's been reaching out to me on WhatsApp, and I found that really reassuring. But I don't think for where I am, the gym's going to be opening any time soon. So I've been looking at trying to order in an exercise bike and some exercise equipment offline. But if you go on to places, like Amazon or whatever it might be, even Argos, places like that, a lot of stuff that they're not selling. There's the platforms aren't open, and they're either sold out, or you can order equipment, but it's not going to be delivered till end of August, beginning of September. So it is looking at about what you've got in your home that can help you. So it might be a couple of tins of baked beans.
Yep, I was picturing the tins.
Exactly, or a broom with a couple of bags on the end, with some sugar, whatever it might be, that gives it a bit of weight. So just get creative and do a bit of a Google or go on YouTube, and you will find something. But you do need to feel that you're encouraged and empowered and supported to do that. It's not just as simple as downloading an app.
I think as well, from the conversations I've had with you and with others, it's about setting realistic goals that are manageable. It is that thing similar with snakes and ladders. If you're trying to set something too high, then you're going to end up feeling like a failure, rather than seeing it as, maybe I'll start with the 10-minute workout, or just doing this many steps a day with whichever app you use, and just doing realistic small things and building it up, because the more you do it, the more you feel like doing more, rather than thinking I'm going to do a whole hour's workout. Because myself included, if I set a whole hour's workout and then I'm dying partway through and I stop, then you suddenly think, what's the point? I couldn't do it. So it's those realistic small steps.
It is setting realistic, achievable goals, making sure that you're hydrated, making sure that you have energy-rich foods. Don't exercise straight after you've tucked into a big plate of lasagna or whatever it might be. And just be mindful that some days you're going to have more energy than others, and some days you're going to want to do a little bit more, and some days a little bit less, and that's okay. That's perfectly okay. So yeah, just in the message of you just be kind to yourself, and just just reach out to others for a little bit of support.
Another thing that we picked up on that was a theme within this was medication management. We unfortunately heard that there's a number of people that aren't going to see their GP and their medication's running out, so they're either stopping taking their medication or they're ordering online. And the problem with that is you don't always know if it's a trusted source, so it can be tricky. GPs are still open, so we're encouraging people to make sure that you have got enough of your prescription, but also to still see your GP. You mentioned that you've had contact with your GP since COVID. Was that over the phone, or were you able to do a video, or how?
Because I had an unrelated health condition, I needed to go in and see a GP urgently, which I did, and that was a very good experience. I felt very safe. There wasn't anybody else in the GP surgery other than the doctors and the reception staff, who were all masked up. There was the plastic or the glass barriers there, and then I had to go back in for a blood test. And subsequently, actually, I've been waiting for a hospital appointment, which is something that's been taking a little bit longer. I have got a severe mental illness physical health check coming up on the 14th of June, which I checked out with them. And I subsequently received a text message saying that you've got a session booked in with your GP. Just be mindful, it might happen over the phone, it might happen virtually. via Zoom or a health app that they're using. So yeah, I'd be interested to see if it happens, how it happens, and to see if it's going to be any different than because it will be a conversation, but obviously I will need to go and get a blood test done to see what my pre-diabetic numbers are, to see what my levels of whatever in my system is, fats, so yeah, watch this space. I guess it's going to be interesting.
I think even the GPs are probably having a bit of a trickier job with it and working out what's necessary, what's feasible, whether or not they postpone it for a month or whether or not they have them now. So I think it will be a journey between everyone, but it's still so important to have your physical health checked if you need it, or to stay in contact with your GP, especially if you're quitting smoking or running out of milk.
If you are on the SMI register and you know you're on it and you're due a health check, or you're not sure when you had your last one, I just rang my GP surgery, said, please, can you tell me when my next one is? And if you're not, then ring up and find out if you've got an SMI register and whether you're able to be on it, because those checks are invaluable. Absolutely.
And one of the things that I loved hearing from you about was the financial planning you did, and the fact that you called up your providers and gave them an honest explanation of the situation, and were able to reduce bills. Are you able to share some of the insights of that to help other people?
Yeah, so one of the things I was going to happen pre-COVID was my pay-as-you-go gas meter, which is situated outside the house on the ground, which isn't good for me, needed to be upgraded to a smart meter. So it's pay-as-you-go. They haven't been able to do the upgrade because of COVID. So I did ring the supplier and said, what do I do here? If I'm not able to go out to my post office and top up my card, what are my options? They said, well, you can do a top up over the phone and we can send you out a prepaid card that has the money on it, and you can stick that in your gas meter, and that will give you the power you need. Also, I had a very honest, open conversation with them about rates and charges and what could they do in respect, and indeed, did they have any offers that were open and available to people? Because quite often, if you don't ask the question, you're never going to know, because they don't always promote, don't always send you letters telling you that you're able to. So, a bit of negotiating, a bit of, this provider provides this plan. I'm not going to say who provides my gas and electric, but you start having conversations with other providers and find out what some are providing that others may not, puts you in a stronger position with leverage to say, I want to stay with you. What can you do to help reduce my bills? What can you do to help me in these times of uncertainty? What can you help to make my life easier? Because if I've got a pay-as-you-go meter, I can't get to the post office, which could be, if you're living in the country, could be any in Norfolk, very rural area. So it's not as easy as just jumping in a car. Even got a car, what do you do? So it's really tricky, but having open, honest conversations. The Money and Mental Health Advice app has some really good resources around budgeting and stuff. And, if you're not able to have an honest conversation with a close friend or a family member, then, those are good places to go and they'll assist you. But there's a lot of support out there. It's just understanding where it is and making contact.
So in our resource, we've shared a number of different helplines, from financial to if you're in a crisis, which I'll share the links below, and I'll also share the link to the resource. Was there anything else that when we had our conversations you found helpful, or that you thought might be a good tip just to share with people?
I think the bit about reaching out to people is really important. And to people who are going to understand you and what's going on for you, So what we really need is to find people who have compassion and empathy and understanding of not just what our our circumstances and our needs are, but how our health conditions really impact on it. So surround yourself with good supportive people, good supportive organisations, you know, and ask questions. And I think you know, this resource will be really helpful for people. And you know, just be mindful that some days will be better than others, and just be kind to yourself and allow yourself the time and space to some days flourish and other days, you know, protect yourself and just distract yourself. And I don't know, you know, just be kind to yourself. You know, I think is good.
No, 100%. I think that's a perfect note to end it on. Thanks so much for sharing, Kevin, and we'll share the link to the resource below. Thank you.
Yeah, great. Thank you.